Doctors of Reddit, what are the dead giveaway signs that someone is faking? Whenever the symptoms aren't there, when the patient doesn't know they're being watched. I had someone fake a stroke recently and walked in on her walking around her room independently after pretending to be limp on her left side, letting us take complete care of her and wiping her butt for her. It was wild, y'all. My favorite thing about this thread is that half of the "here's how you know they're faking" comments get responses that are all "yeah" about that. Let me tell you how that assumption fricked me over and I almost died. One time I was in hospital with decompression sickness and neurological damage and I couldn't piss. I told a nurse I needed a catheter, which she did right away, and I filled 3-liter bags straight off. Anyway, she commented that if a man actually says he needs a long tube pushed up the hole in his penis, then you can be sure he needs it done. Not a doctor but a paramedic. Tons of calls to the jail for inmates with seizures. I'll lift the arm over their face and let it go. They'll move it to prevent hitting their face, or I'll lightly brush their eyelashes and they'll twitch to it. If someone is unconscious, make a fist and rub your knuckles against their sternum, chest bone. Put some pressure behind it and rub quickly up and down, up towards chin, down towards belly button. It's called a sternal rub and is incredibly painful but won't harm the person. It's very hard to completely ignore and continue with the ruse of faking being unconscious. The only more sure thing is asking your partner to hand you the eye needle to take some ocular fluid while they're passed out so they won't feel the pain of the needle in their eye. Eater, there's no ocular needle, at least not on an ambulance. We say that because not everyone knows that and they don't want to risk it. Eater 2, RIP my inbox. Apparently the sternal rub isn't common practice anymore because people literally went too hard. Sorry. Also I feel old AF now. Eater 3. Eater is used on Reddit to mean edited to add. Yes, I know it usually means estimated time of arrival. A nurse thought I was faking that I could not swallow when I woke up from jaw surgery. When I came out of the surgery and was panicking, telling them I couldn't swallow my own saliva, the nurse just told me, yes, you can. This surgery wouldn't have anything to do with your ability to swallow. I could also barely speak and started crying and pleading with her to believe me. I ended up having cranial nerve damage that paralyzed half of my tongue, trachea, esophagus, and vocal cords. It took 8 months to heal. I drank thickened water, which is as gross as it sounds, for 8 months. Having a healthcare professional not believe you during trauma is absolutely scarring. My wife is a doctor, and she had dealt with people faking things like one of their legs simply not working. The trick is to tell them to do some other thing with a positive phrasing, making it seem like doing so will prove the patient's story is true, while it proves the opposite. This works for both people who are actively faking it and people who have subconsciously convinced themselves the problem is real. For example, if they say their right leg can't move, you first ask them to try lifting it, which they try and obviously fail to move or flex any muscles in it. Then you act intrigued and say something like, now your left leg is the one that works fine, right? Go ahead and lift it up for me for comparison. While they are doing this, you still casually have your hand on their right leg, which you had placed there when you were feeling for any activity when they tried to lift it. Now when the person is laying there and lifts their left leg to prove their right one doesn't work, they will naturally flex their right leg to provide balance with their left leg in the air. If they are able to flex their right leg then, but won't even flex it when they claim to be trying to move it, then you know their leg still works. You just have to narrow down if they realize are faking it intentionally. You can be faking good too. Had a tooth kicked out, mouth filled with blood and swelling. I'd stuck a tissue in to try to stop the blood. I've presented to the tridge at the dental hospital. I'm dribbling blood as I talk. She asks me if it hurts, and I said a little bit. She looked at me dead in the eye and said, one of the many things we tridge on is pain. Gotcha. Good nurse. Hurts like a motherfricker. I've literally been kicked in the face. Thanks for that. Notes taken. Was patched up and out of there within an hour. If someone is truly unconscious, their thumb always wiggle. Just say that out loud to yourself. I'm not a physician but a paramedic. Honestly, I don't really care if you're faking, as long as it's halfway believable. I'm still going to treat it as the worst case scenario. Faking a seizure? You'll get a full set of vitals, a blood sugar and a shot of Benzos. There's lots of different types of seizures. If you call 911 because you're in extreme pain and want an ambulance ride, I'll put the good drugs in your vein hole. I'd rather give 100 drug seekers a 100 mcg of fentanyl than withhold it for the one person that really needs it. Can I tell if someone is faking? Yeah, most times, but it goes both ways. If you go too hard, I might assume you have a legit life-threatening injury and sedate, paralyze and intubate you, or start forth sinew, jugular or shin bone. Fake it if you want, but traction may vary. Nurse here. I had a teenager overdose on Zoloft and start having strange seizure-like episodes. What made them particularly strange is that they all followed a predictable pattern of onset. First, he would lower the bed, next he would turn the TV volume down, and finally he would check to see if I was nearby. There was pretty severe thrashing about without any abnormalities in breathing, heart rate, pupils, and he was still able to communicate with me throughout the entire episode. Unsurprisingly, EEG also failed to show any abnormalities. Not a doctor but a therapist. For some reason adolescents like faking did, formerly multiple personality disorder. It's a pretty rare and debated diagnosis in our field. I've seen people fake it by mimicking how it's portrayed in movies and on TV. Red flags are them telling you, I have multiple personality disorder, and, of course, not meeting the actual diagnostic criteria. Some people feel like the common diagnoses aren't big or special enough to accurately represent their struggles, so they cosplay something worse. Whatever you're working through is a big deal to us. If you feel like you have to fake or exaggerate your symptoms for your therapist, consider finding a different therapist. Editing to clarify my last sentence, since I'm getting some aggressive replies. If you don't feel like you can be authentic with your therapist, continue searching until you find a therapist you feel comfortable with. Sometimes it's just not a good fit. It happens. You're not obligated to continue seeing a therapist you don't feel comfortable with. If you feel like you need to fake or exaggerate something to be taken seriously by a therapist, it's not a good fit. Continue searching until you find someone who takes you seriously. Also, I'm not a solid resource for DID information. It's not a common diagnosis and my experience with it has been extremely limited. Stick to peer-reviewed information and experts in the field for the most accurate and up-to-date information. Not a doctor, but I once had a nurse tell me something that stuck with me ever since. I had a gallbladder attack when I was younger, and let me tell you, that's some of the worst pain I've ever felt. I was doubled over, vomiting bile, and unable to move. My mom took me to the ER at 1 AM in the middle of a snowstorm. As the nurse was doing my initial evaluation, she asked me the standard on a scale of 1-10 pain question. I thought for a couple seconds, and told her 7 or 8. It hurts really bad. She nodded knowingly and told me got it, it hurts really bad. Most people who tell me 10 are lying. No one ever feels the 10 inches. In hindsight, I'm not sure that's the best practice for a nurse. Still, after seeing drug-seeking patients myself, I understand her frustration. They ended up giving me morphine, which brought that number down quite a bit. I have the reverse. My back went out, extreme sciatica pain, like being struck by lightning constantly. Couldn't move for days. When someone found me 3 days later they called 911. Just for the doctor to tell me I was faking it for pain meds. While I was crying in pain I asked him why I'd lay in a pile of my own piss and crap for 3 days for some Vicodin when I literally own a bar. Freaking insane. I'm a nurse on a floor that deals with a lot of chronic and acute pain patients. Most recent instance was this lady from a few weeks ago that was apparently splitting the oxycodone we were giving her in half in her mouth, and then when the nurses' backs were turned, she would stuff it in a pill jar. A night nurse caught her in the act and all of her crap had to be searched. We found 20 half tablets of oxycodone she had been stashing. She told us that she was saving them for her family in case they need them, because it's just so hard to get an oxycodone prescription these days. I had her a few days after that, and she was having some abdominal pain. Stat X-ray showed only gas. She just really needed to fart. But she was screaming, claiming it was a 10, and making a huge freaking scene. She demanded Dilaudid through her fourth, and she wanted it to be pushed fast. Huge red flag right there. She wanted the high, not the relief. Doc straight up said he wouldn't give her Dilaudid because she was already on so many opiates. She then demanded lorazepam, still through her fourth of course. Doc was like fine whatever, just one time and only a low end dose. I was flushing her fourth with normal saline first, to make sure her fourth was patent, and she leans back, and is like oh that's so much better already. Hadn't even given her the lorazepam yet, SMDH. Not a doctor, but doctors often think my family is faking. For an unknown reason. When there's something wrong with our organs, our white blood cell count doesn't go up. My younger sister got appendicitis when she was in her early teens, crying from the pain, but blood work showed nothing was amiss. If it hadn't been for other tests and my dad's insistence on them, she might not have been treated in time. So they open her up and surprise, a gross appendix that was close to bursting. My dad insisted, because of an operation he had just had to remove his gallbladder. He was in so much pain that he was vomiting, could hardly walk. It had been building up for a while, and he was pretty sure what it was. He went to the doctor, but blood work showed his white count was normal. My dad had to scream in agony on their table for ages before they finally gave in and took him to surgery. They go in, see a perfectly healthy looking gallbladder. They pull it out, cut it open, and sand spills out. Dry sand. We learned later that it had completely stopped working and totally filled with protein chains. It was removed before it started killing my dad in earnest. So yes, people fake it, people lie, but do double check just in case. My sister is a pediatric audiologist and this is my favorite story of hers. Apparently, sometime in elementary school, usually the early grades, a ton of kids like to fake hearing loss. Like not just oh, I can't hear the teacher. Full on, want to get hearing aids, etc. Anyway, she explained to me that, based on the way she plays the tones, you can usually tell if someone is faking, especially when they just pretend they can't hear anything. But it's not 100%, obviously, because hearing loss patterns can be really weird. However, she's caught a number of kids simply by saying, okay, so I'm going to play a random number of tones and they'll go in both ears. I want you to say back quote yes if you hear it and back quote no if you don't. Obligatory not a doctor, but I got a call from my son's school nurse when he was in 2nd grade, and the conversation went like this. Nurse sounding upbeat and cheerful says, your son wants to tell you his terrible news. Son gets on the phone, says hi mom, I cut my finger off. I ask him, where is your finger now? Son, I put it back on. I said, can I talk to the nurse? Nurse gets on the phone again, says, sounds serious, right? I asked, does he have a substitute teacher today? Yes. I told the nurse to let him know I will take him to the hospital for a shot for his finger, to which he says I think it's okay. I glued it on really good. Nurse kept him in the office for a bit to talk about scary changes in the classroom. I don't know why anyone would want to fake anything medical, unconsciousness in particular. I got a compound fracture recently and called 911 on myself and was put on hold. Fun stuff. But got through and asked them to send help. Operator was a badass and kept asking me questions to keep me conscious. The ambulance folks arrive, casually got out of the ambulance, walk up to me, and then saw the bone sticking out of my body and said, quote, oh, you're actually hurt. Yes. Did you think I called 911 because I spilled some lemonade? Then it occurred to me that most of their calls must be horse crap. But to cause me even more confusion, I received close to a $2,000 bill for the privilege of actual help and the ride to the hospital. That ludicrous bill is no fault of the M's. I'm very much appreciative of their existence and they don't get nearly enough credit. But the best part of receiving that bill? The ambulance ride was roughly $1,850. The fentanyl they gave me was $2.15. The inverse of this question. What can someone do if they are not faking it, but for whatever reason they have multiple doctors insist they're faking it? But by never telling the patient they're faking it, nothing is ever resolved, and it drags on for months and months. When I had a stroke 10 months ago, my biggest fear was I was somehow faking it, and the ambulance ride was a sham. And why was I doing it? No, it turns out I was having a stroke. I was so worried I was being a faker, although I have never done that before. Just a really odd mental state. I'm in the middle of being treated like I'm faking, and it's really frustrating. I had a tool slip at work and hit me in the eye and forehead. Knocked me out for a second, and I lost sight in my eye. An hour later I started getting my sight back, but it hasn't fully come back. It's been months now. Two things I got diagnosed with were ocular migraines and vitreous detachment and a concussion. But none of those things explain why my vision is still blurry in my right eye, except the VD, which causes floaters. But my issue is blurry vision, like I have Vaseline in my eye. But doctors keep telling me I'm fine, that I need to go back to work. One doctor told me to think about the economy and that I was lucky to have a job right now, so I quit my job. I still want to see out of my right eye, but none of the doctors are taking me seriously. Most often their story/description/exam doesn't make any sense. There are usually things that contradict each other. Abdominal pain is generally easy to tell when people are faking it. For example, I will press with my stethoscope instead of just listening. They don't respond to that pressure, but will when I use my hands instead. Sometimes I'll ask them if they are experiencing a symptom. That will rule out a diagnosis or make it less likely, and many times they think I'm asking it to support their supposed issue, so they will say they have it. Most of the time people aren't faking, but just blow their symptoms out of proportion. Still sometime in officially becoming a doctor, but have been taught what to watch out for. A doctor expects symptoms from you, not signs. People who Google diseases often tell SIGNs that they shouldn't be aware of refusing blood work, exaggerating your condition description, not matching their history around public holidays/long weekends. Suspicion is always increased. Brief note for all the student doctors out there, people can pass stroke field tests and still be having a stroke. I could do everything on the list while I had a clot in my brain, verified by court and MRI, except I couldn't stop vomiting. Good times. Be aware sometimes crap doesn't look like you think it should. I went to emergency once with intense chest pain. The young, new doctor I saw first listened to my chest and immediately concluded I had pericarditis, but the supervising doctor decided I was faking it for drugs for some reason. The next morning I woke up to a psychologist in my room asking all sorts of random crap when an orderly interrupted because the ultrasound guy was in and wanted to see me first thing. I think after talking to the first doc I saw. Turns out I had pericarditis and myocarditis, and the dude wheeled me out himself and told them order an ambulance to take me to a hospital with a cardiac clinic. As a patient, it's apparently very sus if you say you don't want an oxy script. I had some crap happen. Doc started filling one out for me, and I told him not to bother since I wouldn't fill it. He got annoyed and said he wouldn't prescribe anything stronger. I got annoyed and said I didn't ask for anything stronger. For fricked reasons, oxy/hydro/codeine don't work for me. Advil literally does more for me than any of those, so I'll just take ibuprofen. But apparently the way I phrase that makes doctors think that I'm asking for better meds instead of explaining that I'm just not going to bother with the worthless ones that they default to. Hey guys, just wanted to remind everyone to be careful here. Patients lie, that's true. But it's important to remember that in the US there's massive levels of discrimination and lowered standards of care for many patients due to staff's perception. Be very cautious. Thinking someone's faking when they're really not can lead to serious consequences for both staff and patients. I had a 360 testicular torsion and a doc thought I just had some inflamed glands due to my reactions. Luckily I came back after they sent me home, or I would have lost my ball. Thank you for watching the video. Tell us your stories in the comments below. See you soon.